Hello, everybody. For those of you who don't know me, I'm Chris Pollock. I'm the Director of Communications and Marketing here at Wells. I hope you all are doing well and staying safe and healthy. I'm excited. We're all excited to have you return to Aurora just in a couple short weeks. I just also want to thank you for taking the time to attend this session. It is being recorded, and we will post it online afterwards in case you didn't get a chance to see it live. Although this year is obviously going to look different for all of us, I just want to assure you it's still going to be a great year, and it will still be the Wells you remember in most cases. We're certainly going to be taking a number of precautions that you'll hear about tonight. Many of these are things you've probably already gotten accustomed to, like wearing masks, social distancing, plexiglass, doing more things online. You'll hear much more about that tonight. But for now, I would like to turn it over to President Gibraltar to welcome you all this evening.
Thank you, Chris. Hi, everybody. I'm so incredibly happy to be able to speak to you and welcome you back to campus in a couple of weeks. I can't even tell you how much we've missed you. I think it would be impossible to put that into words. These past months, I know, have been stressful for all of us. And I know for many of you who have been pretty much stuck at home, this has been a really different time. And when you come back to Aurora in a couple of weeks, it's also going to be a very different time, but we're ready for you. And we believe that in our small, very caring community, that we can keep each other safe and we can keep each other healthy. We have spent literally months working on a plan to bring you all back and to keep you safe. And it's not just the people on the screen tonight on this panel who've been working on this plan. It's everybody, our faculty, our staff, and we've had the involvement of students as well. As Chris said, campus life's going to be a little bit different this year. There's going to be social distancing. People are going to have to wear masks. There's going to be density control in dining hall and in the summer center and in the pub. Classrooms are going to have social distancing. And you might even find a few classrooms outside in tents over the earlier part of the semester, which actually sounds kind of cool. The one thing that I want to say is that we need every one of you to be involved, to be engaged, and to be socially responsible for one another. We can't do this alone. We need your help. And one thing that I know and love about Wells is that this is a community of caring people and that we can do this. And we can actually demonstrate to other colleges and universities across the country why Wells really matters, why we're in a community of people who care. So Dr. Kenyon is going to go over our plan with you. And we want you to listen carefully. But the very first thing that I'm going to ask all of you to do is go to the college's website and read our return to campus plan. And I don't mean just skim it, I mean read it. And if you have any questions, ask them now before you come back. I'd rather have you ask them now because maybe there's something we didn't even think of. And your asking that question is really going to help us to better understand how to make this work. So read the plan. That's part of what we're asking of you. And Dr. Kenyon's going to give you some overview of it today. And over these next couple of weeks, we're going to be available to you to ask questions. So with that, welcome back to Aurora. Really looking forward to seeing you all in person. And thank you for joining us this evening.
All right, now I'd like Dean Kenyon to help us dive into some of the details of that plan. Just 1 minute while we get situated.
Good evening, Wellsians. Welcome to our college plan for COVID compliance. I'm a little muffled with the mask, but the mask is key to success. I'm sure you've been wearing that all summer long. The arrows don't advance, so let's see. There they go. Thank you. Good evening again. This plan for Wells College successful reopening requires a focus on personal responsibility. You've known that over the years through the Honor Code. We'll be adding a community care pledge to our Honor Code this year. And our real request is everyone needs to monitor their daily health. That's the only way we'll keep our community safe, is if everyone pays attention to their daily health. These arrows. So this community care pledge, it's a little small on the screen, but you should be able to see, especially the highlighted part. We're asking you to recognize that it's your responsibility to act in ways that minimize the threat of harm and help stop the spread of the coronavirus. But we're not just asking this from you, our students. We're asking our president, our faculty, all of the staff to take this same pledge, the pledge of personal responsibility, to commit to doing the things we need you to do to keep our campus safe. So we'll be going over many of those things in this presentation this evening, but be aware that we think this is not anything burdensome, because you know what it means to follow the Honor Code and to care for our community, and we're just extending that to our pledge for community care. So what are we going to be doing? We're going to be trying to focus on prevention, and that starts before you get here. We want you to undertake pre-arrival testing. If it's possible in your community, see if you can get tested before you come. In case you test positive, we want you to be able to stay at home and work through the isolation period that might be required. We also ask that you be cognizant of what you're doing in the weeks before you come to college. It would be great for 14 days if you practice really extreme social distancing, stay away from community gatherings, going to bars or goodbye parties where you don't know the people that you might be hanging out with. Be sure that you keep yourself socially distant and safe before coming here, because when you get here, we'll be asking you to take a test to see if you have the COVID-19 disease. That's a required test, and so it'll be happening on the first day you get here. You'll get results that day or the next day, so we'll know whether you have any issues that we need to address. There are many of you coming from states where there's a New York State quarantine requirement. So when you get here from any of those states, we'll be housing you in Dodge North for the period needed for you to complete your New York State 14-day quarantine requirement. So be aware that that's going to happen. I think you already know about it. We'll make it as easy and comfortable for you as possible. When you get here, every day you're going to be completing a screening app on your cell phone. We'll talk about that in a minute, but that screening app is just to clear you for being healthy enough to come to class or come to work. And like I said at the beginning, face masks will be with us all times, along with social distancing. So that's some of the elements of our prevention, along with hygiene, cleaning and disinfecting. You'll see hand sanitizers everywhere. We'll be doing aggressive cleaning of common areas and restrooms. More signs telling you how to keep your mask clean and what the guidelines are for keeping our community safe. All of these signs are being put up on campus right now. We've asked you to return in a phased arrival. trying to give you a chance to come back on a day that works for you, but a day that keeps us from getting too many people on campus at one time. So our student leaders will be coming next week. New students will come on August 21st and 22nd. And you, the returning students, we've got August 25th, 26th, 27th, and 28th. You can pick those days that work best for you and come back to campus. We're going to have about a quarter of the population each day to make sure there's enough social distancing during move-in. All of that's to get you ready for classes on August 31st. We are asking that a guest be limited to one guest to help you with move-in. If you've got several people, family members coming with you, just one guest at a time in the residence hall. You can change your guests. Your mother can come up and help you get the bed made. Your father can come up and carry the things up and out for you. People can help, but one at a time. So we're just trying to maintain social distancing as we help you move in. And let me say, there are questions you may have that you should ask through the chat, and we'll try to answer your questions during this program. Go ahead and ask those through the chat, and Chris Pollock will be monitoring to see if you have any questions. He'll interrupt me, and we want to make sure your questions get answered right away. Again, the face mask is going to be everywhere. You can bring your own, or if you don't have one, we'll give you one. We're able to provide you face masks, anyone who needs it. We'll be providing hand sanitizers around campus, face shields if they're needed for certain labs, studios, or classes, and any additional protective equipment for any special circumstances anyone might have. So we're going to make sure we have the PPE requirements covered. You may see some difference in how we do things. We've made some adaptations to our operations. So what are these adaptations? Well, in the academic area, non-punitive attendance policies. And maybe I'll ask the provost speaker to explain what is a non-punitive attendance policy.
We're asking faculty to, as they develop their requirements for their courses, to keep in mind that students may not be able to attend because of needing to be in quarantine or isolation, or possibly needing to be at home to recuperate, and to be able to allow that to happen, and for students to be able to work at a distance if they need to. So it doesn't mean that you don't have to do what's required for a class or engage in the class. It's thinking about how faculty are arriving at their final grades.
And now you can see that we'll be delivering courses in a number of different formats. So we're going to make sure that students, if you go into isolation or quarantine, you have the capacity to keep up with a class. We'll have technology support. Classes will be, you'll not be sitting right next to each other in class. You've got to keep the 6 feet of distance in the classroom setting. Office hours will be kept with 6 feet of different distance. So all of that's the cardinal rule for keeping COVID contained is face masks and social distancing. So we're going to be following that rule and asking you to do so. In the library, you'll have reserves through electronic format rather than what you're used to. The faculty aren't going to be traveling as much to conferences. There will be some limits on cross-registration at local colleges. You won't see as many experiential or field trip programs taking place. And if you have materials or equipment in labs and studios, those are going to be cleaned, if they're shared and disinfected, and there'll be some rules that'll be applying to safe use of equipment. One thing the faculty won't have as many of is guest lecturers or visiting lecturers. We'll have some probably, but it'll be managed in a way that maintains our social distance and space use requirements. So anything else in the academic area, Cindy, you might want to mention at this time? Or do we have any questions for academics?
So I would just say that as we're working on finalizing course schedules in terms of some changes due to low enrollment courses or some changes to faculty, um, you should be able to go onto the Globe, and within the description of your courses, you'll see it'll either say that the course is face-to-face instruction, hybrid instruction, or remote. If a course is labeled remote, it's remote from the start for the entire semester. Hybrid courses are a combination of some components being face-to-face and some components being remote. And many of those courses are hybrid in order to reduce the number of students in a classroom or a lab at any one time. And then face-to-face courses or face-to-face instruction would be what you're more used to at Wells. But to keep in mind that all faculty are preparing that should a student, even in a face-to-face course, have to be remote for a week or two in order to keep up with the course because of illness or something, that they'll be able to accommodate you and be able to work with you. So I think that's important. And keep in mind that classes start on August 31st. There will be no fall break this fall. Those 2 days of classes that are usually canceled during fall break are now part of Thanksgiving break, which will be a full week in November. And prior to that week is really when people will be going home. And then we'll be doing fully remote courses across the board after Thanksgiving when classes resume on November 30th. Students can still stay on campus during Thanksgiving break and finish out the semester. If it works better for you to be on campus rather than being someplace else, you can do that. But if you leave campus for Thanksgiving break, you can't come back to campus to finish out the semester.
And nor do you have to move entirely out of your room. I mean, you should, when you leave for Thanksgiving, prepare yourself that you probably won't be back for a couple of months, depending on when the spring calendar begins. But we've been asked several times, do students have to move entirely out of the room? And that is not the case. Cindy, I wonder also if for students in our education program, has any decision been made yet about if student teaching placements are going to happen? And if so, is there any information to share?
Yeah, so New York State Ed came down with guidance about a week or so ago, and they're allowing us to have some flexibility in terms of assignments for student teaching, in that they're actually allowing remote student teaching to take place as well. Susan Wanzer is working with a number of school districts right now in terms of our student placement for the fall. And I know from her, I spoke with her earlier this afternoon, that at least 2 of the districts she's working with are allowing actually student teachers in the classroom, and they've been approved. And there are some other placements that the districts are only allowing student teachers to be remote. So it'll be a mixture depending on where you're placed. If you're worried about student teaching, please be in contact with Susan Wanzer. Trust me, she is on top of it, and she's working really hard to make sure you have the best experience we can provide you during this time period.
Great. Thank you, Provost Speaker. So in the area of residential life, some of the changes you might see, there will be this initial self-quarantine. When you arrive, we'll ask you to take a test for COVID, and during the 24 hours it takes to get results, we're going to ask you just to be self-quarantined, stay away from other folks until we know if anyone has to be put into isolation or quarantine based on the test results. You'll be treated as a family unit in your residence hall. The folks who are share a same room would be considered a family unit, so you can take off the face masks when you're in your residence room. But when you go outside your room, treat it as going outside of your house and into the village, that you need to be wearing your mask to protect others as well as yourself. Within the residence halls, we'll be working with our resident advisors to create some programs and activities for you. So they have to be pre-approved and make sure that the program is going to comply with social distance and mask requirements and the capacity of a space that's being used. So your own spontaneous social gatherings won't be tolerated. We're not going to be allowing people to have house parties in the residence halls that get people together without the social distancing and the mask. It's just unsafe, just unsafe. The same with visitors. We want to allow you a chance to have visitors, but that would be in the residence hall lounges. We don't want students mingling together in their rooms in the small spaces where the germs can be shared so easily. So there's no overnight guests in rooms and no sharing of room spaces. For visiting, it's the lounge space that we want you to use to visit with each other. Emily, anything further that you've been hearing about residence life that you want to share? Emily Burt?
Yeah, so an email went out regarding move-in today for returning students. So make sure to check your email if you haven't done that yet. The sign up for move-in is just for returning students. So if any new students snuck in here tonight, you'll be assigned. You'll be getting information about that by tomorrow. But so returning students, you do need to sign up for move-in. As Jean Kenyon said earlier, we will be having about a quarter of the population coming back every day. So you need to sign up for a specific day and time for your residence hall to make sure we don't have too many folks moving in at once. But yeah, I just think I would reiterate, what Dean Kenyon had said about making sure you're wearing your mask when you're outside your room. Even if you're just, going across the hall to the bathroom, you need to be wearing your mask at all times when you're outside of your own residence hall room.
Thank you. In our dining area, it'll be a little different experience. There will be a capacity limit in order to have social distancing in the dining hall. So we're going to be working with you to spread out your time of going to have lunch, breakfast, lunch, and dinner. We need you to help us spread out the time. So about 120 people at a time is the maximum the dining hall can allow under social distancing. They'll close the door when they hit that number. And we're going to make sure nobody's gathering closely, waiting for dinner. You'll have to be spaced out 6 feet apart in the waiting line. So we'll be working with you to find ways to make sure the dining hall works and keeps everybody safe with the social distancing. They are going to offer a lot of meals to go options. They'll be able to pick them up at the dining hall or the well. You can even call ahead to order meals and have it picked up. 24 hours ahead of time, you can make an order. There'll be outdoor seating at Ryerson, and so plenty of additional space for people to gather. And if you, for some chance, you're placed in isolation or quarantine, meals will be delivered to you in Dodge North. So it's going to be a little different, but we'll be making sure everyone gets fed. When you go in the dining halls, it'll be the buffet line, but you'll be served rather than serve yourself. That way they'll have more coverage over the food, and they'll be controlling any kind of concerns around health conditions at the dining food delivery. So
think of it as like going to Subway, the restaurant. They kind of travel along with you.
Good, thanks, Chris. Athletics. Mike Lindbergh, do you want to talk about athletics? How that's going to be different?
Thanks, Charles. Yes, and looking forward to seeing everybody's return in the next couple of weeks. I hope you've all had just an opportunity to have a great summer. As many of you who are athletes may have been keeping track of, is the NCAA Division III has decided to cancel all of its fall championships. And prior to that, many of the conferences, if not all of the conferences, have decided not to engage in any competition at all this fall with the fall sports. But that doesn't mean we're not playing, okay? We're going to be doing a phased-in approach to practices, team building, skill development, personal fitness, all the things that go into. The only thing we're not going to be able to do, at least for this fall, is compete against outside competition. Decision hasn't been made yet from the NCAA or from the conferences, the Commissioners Association, about what we're going to do this fall with our winter sports. So we have swimming, and we have men and women's basketball. In some cases, some conferences have already decided that they will not allow their teams to compete until after January 1st. We haven't done that yet. We're going to just monitor the situation. As you know, everything is it's just going to be based on the data and the science at the time. So it's a real point of emphasis that if all of us do our parts and all of us are doing our part, we might be able to enjoy some of the fruits of our labor later on in terms of athletics that would be able to compete against competition within this region. We are planning on having some recreational programs offered throughout the year. Some of the adaptations that we're making in compliance with New York State guidelines and requirements. We will be opening the fitness center, but it'll be outdoors. Okay? We're going to be offering a schedule for the use of the boathouse and swimming there and the use of the boating equipment. Tennis courts will be open. Let's see, the gym will be monitored and it'll be open in a schedule, and we have to go by the just reduced capacity of use of the gyms. The pool will be open for swim, indoor pool will be open for lap swim only. And that's where we are right now. But the more we can do to take advantage of our recreational facilities and the gorgeous lake that we have while the weather is beautiful, we're going to take full advantage of that. Some of you are taking physical education courses. Right now, we are currently looking forward to going primarily face-to-face. In some cases, it will be hybrid. For example, I just received word from Chris Rosen that she will be doing most of her yoga and meditation face-to-face. Martial arts, kickboxing will be done a combination of virtual for one class period and face-to-face for another. Horseback riding is getting full, and we're able to do that. So that'll be great. And scuba, which is also full, we're able to do that as well. So we're real pleased that we're going to be able to offer a full complement of physical education courses for you this fall. I've also had the opportunity, if I can mention this now, Charles, of working with an outstanding group of people, an outstanding team of people who are coordinating the orientation program. As you noticed in the in Charles's earlier slide, our first year students will be arriving August 20, where am I right now? August 21st and August 22nd. We're going to split things up. Our returning students, as you will all be returning the 25th, the 26th, 27th, and 28th. Orientation this year is going to take place throughout that entire week. And so the first few days, from Friday through Tuesday, we're going to be focused primarily on providing our new students with some transition programs, just getting them adjusted and learning about some of the WELS ways, all right? And then when you all return come Tuesday, Wednesday, Thursday, Friday, we will have some programs, particularly in the evening, our social and recreational programs, where we can get our returning students to meet our first year students. And then after that, we'll be one big happy family again. So a lot of things going on, but most important is you stay safe, and we're looking forward to seeing you when you arrive in a couple of weeks.
Hey,
Thanks,
Mike,
Charles.
quick question for you. I know you mentioned physical education classes, and forgive me if you've already mentioned it. What about athletic training services? Will those be available for student athletes this fall? Has any decision been made there yet?
Yes, Zach and hopefully it'll be, and I believe it's Grace, will be returning since our teams will be practicing. Okay, we'll be engaging in activities. Some of our student athletes will need to do their rehab, from any injuries that they may have sustained over the summer, okay, or while they're practicing here. All of that will be in place. There will be a need for you to turn in any health forms that if you haven't turned in, that's if you're a new student. All of our student athletes, even though we're not competing, will still need to do the baseline testing for concussions. We will be monitoring and injuries, doing our injury surveillance throughout the year, and our full-scale services will be available. Again, looking a little different. I mean, we can't pack the athletic training trailer as some of our teams have experienced. There's going to be a limit as to how many can go in. There will be appointments in order to help maintain that limit. Folks will need to be masked. Zach and Grace will be shielded. So it'll look a little different, but the service will be just as fine.
Chris, are there some other questions that have been popping up that haven't been answered in the chat?
There was a question about internships. In particular, will 2 still be required? The student who's asking says she's done 1, but it might be difficult to find a second one these days. So Cindy, can you address that?
Actually, I'm going to ask Linda to address that since her office is responsible for internships.
Sorry, Linda.
Sure, no worries. Okay, so yeah, so I've been having some conversations with some of our community sites, and I'm finding that more and more sites are discovering ways that they can set up remote experiences. And I don't think we want to rule out on-site experiences completely, really working with sites one at a time. So I will be working much more closely with students and with the sites to make sure that you're able to get those experiences in a safe, healthy way for both you and for the site personnel. So I'm not feeling too discouraged about internships for the fall or J-term and moving forward.
Well, I think there's one thing that COVID has done for us across society. It's made everyone a little more flexible and willing to adapt, right? Cindy, there's been a couple of questions about, for majors that might only have 1 or 2 professors in them, what happens if, say, there's only 1 professor and that professor is ill because of the virus or for any reason? How does that work? Is there contingency plans in place?
Yeah, so I mean, that works like it normally does for us. And because we are small, we often have to address these issues in terms of if something happens to a faculty member. Faculty are making contingency plans should their courses need to go fully remote if they're not starting off remote. And obviously we would use that contingency plan to help find a substitute instructor who would probably then take on the course remotely should somebody not be able to continue to teach.
And then one more question before we continue about residence halls and the cleaning. One person asked, in the reopening plan, it says that the res hall bathrooms will be cleaned daily. Does this include weekends? And I'm not sure if anybody in this panel knows the answer. Cindy, you're nodding. Okay.
Yes, it's
Facilities.
residence hall 7 days a week.
Yeah, that will include the weekends as well. And also options will be available. Supplies will be provided for students to be able to clean themselves as part of the community, before or after use as needed. So, B&G will be in all the public spaces and bathrooms once a day, including weekends, but there will also be opportunities that if you feel more comfortable before you use a space and after, then that will help with the sanitizing efforts as well.
Great, thanks, Emily Burt. Dean Kenyon, why don't we go back to you to continue?
Well, all of you know about our traditions at Wells. Dating back over 100 years, it helps create the community that we love on campus. We're going to continue those traditions. We just have to be creative and clever about how we celebrate our traditions using the social distancing, mask wearing expectations that are required. I'm going to be looking forward to seeing what creative ideas our students have for how these traditions will be maintained under these guidelines. So I know we're up to it, and we're going to keep up with our traditions. We are aware that some in our community are vulnerable. The Center for Disease Control does have a list of illnesses that they identify as creating a medical vulnerability for individuals who have a condition, and that we need to provide accommodations, whether you're an employee or a student. Employees are working through the Human Resource Office, and students would be working through the Student Success Office. Emily, Madison, do you want to maybe let students know what they need to do if that's a concern?
Sure. So as Charles mentioned, those requests will still come through my office like they would have before for any of you who may have worked with my office in the past. The slight difference in the age of COVID is, as Charles mentioned, students who have a disability or medical related condition that puts you at additional high risk for COVID would make you able to seek accommodations to do remote learning from home. Other requests for remote learning can be submitted to my office. I will caveat that with the fact that my office and myself included will evaluate those on a case-by-case basis and work with each student to figure out how we can move forward and make a situation that's going to work out. Documentation for requests will occur as normal for regular accommodations, and for the students who are in the high-risk groups and you've never worked with my office before, you'll need to submit documentation from your doctor or provider and go through the process, which will look the same as before, and I can guide you through that if you contact me about those requests. The other addition I would make at this point to make students aware, I am funneling all of my forms into an electronic process. So that will just mean limited contact in person to try to keep everybody socially distant. But again, contact me if you have additional questions, and we'll work together to figure something out.
I have a question for Dean Kenyon or his team that I've seen a couple times in the chat, but I've heard that question elsewhere, which is, once students come to campus, they get tested, and I know we'll talk about screening and testing here in more detail in just a couple of minutes. Once they get past that initial period, we've been getting a lot of questions along the lines of, can I leave campus to go to Ithaca, to Wegmans? Can I have a job off campus? Can I go visit my family, on the weekends? What's the guidance there?
Well, students need to know that we are allowing students to leave campus as they need to. You can go about your life as normal as possible. We want you to view this as the same WELS experience you've always had. Whatever you do, wherever you go, just do the social distancing, wearing your face mask, follow the rules of the business or organization you might be going to. And that is consistent with everything the governor has asked us to do in New York State. And so the problem would become if you go down to a party at another school and don't engage in proper behavior, then we'll have a problem, and we'll be wanting to prevent that as much as possible. And we're asking you to do your part to help keep us safe. We need you to let us know if someone has done that, because it puts you at risk, and we need to talk to people who are doing things that create a problem for us. So it's a shared responsibility again. Travel is allowed. We're not a prison, we're a college. And so we want you to have the full life you can lead here.
Hey, Charles, could I just get a clarification? If a student decides they want to go for the weekend and go someplace that's in a state that is currently on the New York State restricted list, when they come back, do they have to quarantine for 14 days?
Yes, they do.
Okay.
So that list changes from day to day, but that would be applied for the state that they've entered and been in. You can travel through a state and not have to quarantine. So, but if you're staying in a state, you do have to. So let me talk a minute about this screening and testing. These are really the anchors in our plan for keeping you safe. Screening lets us know every day, lets you know if you're safe to go to class. We've got a phone app. You'll be getting instructions for how to install this app on your phone. It can work on a computer if you don't have a phone to use. It'll go on your PC or laptop. It'll give you 4 questions to be answered every day. And based on your answers to those questions, you'll get a green light cleared to go to class, or you'll get a red light that says you need to talk to our telemedicine specialist to learn more about what might be a problem for you. Perhaps you're reporting headaches, sniffles, sneezing, and you are referred to the telemedicine visit. They may ask you questions, find out, do you have allergies? Have you had this every year for the past 10 years? Things that would help determine whether the condition you're reporting is COVID related, or if it's something just that you're normally used to experiencing. And you may be referred for additional testing, or you may be cleared to go to class. So the telemedicine is an important piece of our process for screening, and you'll do this every day. Every day before you go to class, we're gonna require you to complete this cell phone app. If you don't do it and you go to class, teachers can ask you to show the green light. And if you can't show a green light, they'll tell you to go home. They should tell you to go home, and you shouldn't be there. If you don't have the green light, you shouldn't be at work or you shouldn't be at class. And we're doing that for everybody. So be aware that we'll be doing the daily screening. And the questions are pretty basic. Have you tested for COVID positive? Have you been in contact with anyone who's tested positive? Do you have any symptoms of COVID? And they'll ask you about the symptoms. Or have you gone to any of these states on the restricted list for New York State, as Mike asked about? So if any of those things apply, your screening would be sent to the telemedicine, and then you'll be given some instructions on what to do. Every day, every one of us is going to be doing this before we go to class.
And I just
Folks,
want to, you know, oh, I'm sorry, President Gibraltar.
That's okay, Chris. I just want to say that I have complete respect for everyone in our community, our faculty, our staff, and you, our students. You have to answer these questions honestly, because if we end up with an active case of this virus on campus and it begins to spread, it's possible that we could end up having to shut the campus down again and sending everyone home. We don't want to do that. And that means that everybody has to do their part.
Thank you, John. As I mentioned, the screening results. Chris, you had something?
I just was going to essentially, you know, President Gibraltar took the words right out of my mouth, but, you know, I wanted to add, not only is this something that the New York State is requiring us to do, both for employees and for students, to screen on a regular basis, which is to present these questions, but it's also, you know, it's very important that if there is a case on campus, it's one more piece of written documentation that we have that, if, I don't know if you all are familiar with the term contact tracing, but if there's a case of COVID, and the dean will get into this in a minute, essentially it allows us to kind of track down who other people might have been in contact with. And this daily screening is really one very important part of it. So as Andre Lynch said in the chat, it's really, really, really important that you guys, all of us, you know, answer honestly and not blow it off.
And commuters will do this, employees will do this, visitors will do this. Screening is going to be required for everybody coming to our campus. So it doesn't matter what your status or what your role is, you will be screened. Now, the possibility exists that you felt okay at the point in the morning at 8 a.m. when you did your screening, but maybe by 3 o'clock you're feeling pretty sick. We're going to ask you to come and tell us that you're feeling pretty sick. We want you to get connected with the community medical center. We want to get you tested if there's any COVID concerns, or maybe there's some other illness that's taking place. We're telling employees they've got to let us know and get connected with their healthcare provider. We want students to take care of themselves when you're feeling sick. If your symptoms change, let us know. So we have a way to support you. So along with the screening, there is testing. I've already mentioned that you'll be tested upon arrival, and it's the reliable test, one that will give us good confidence that the information is accurate. We're working with Cayuga Health System. They're in Ithaca, New York. They're partnering with us, with Cornell, Ithaca College, Tompkins County Community College. So they're a big company doing the work in this area. They're testing everybody who is recommended for testing through the screening process. That could be me, it could be Andre, it could be you if you are tested, your telemedicine visit says you ought to get a test. So we'll be asking you to get the test when when you're recommended to do so. But you know, we're also checking the whole community. How do we know that our campus community as a whole is keeping this COVID contained? Well, we'll be asking everyone, faculty, staff, and students, to be tested once a month. Every 4 weeks, we'll test our community and make sure that we know where this COVID disease might exist so we can stamp it out. So those are the testing and screening procedures. You need to know that contact tracing, isolation, and quarantine may follow from the test results. Contact tracing is handled by the Cuyahoga County Department of Health. They really take over any positive cases, whether it's employees or students. They instruct as to whether isolation or quarantine is needed or any movement restrictions. They'll ask, who have you been close to? Who have you had contact with? So some people may become a subject of contact tracing. And then you'll be asked questions about your contact with the person who tested positive. If you're testing positive, you'll be put into isolation in Dodge North. We'll be inviting you to go home so you could be recovering at home if you are testing positive, but it's not possible for everybody. So we've got space in Dodge North set aside for isolation. Quarantine may be required if you're being a subject of contact tracing, and that's also in Dodge North. So we're creating facilities. We'll limit the number of people in each suite in Dodge North so that bathrooms are only shared by the fewest number of people. There is a possibility there may be more people in quarantine than Dodge North accommodates, so we've arranged for the Quality Inn or the Gould Hotel in Seneca Falls as backup locations. We're not planning to use those except in a real extensive demand, which we hope to avoid. And with your help, we know we will avoid. So if you're not cleared under the daily screening, you might be placed into quarantine. If the contact tracing makes it required for you to go into quarantine, then you'll be put into Dodge North. Or if you come from one of the states on the or from international locations that do require quarantine. Those are the only ways you would get into the quarantine facility. We'll talk a minute about what happens when you're there. But isolation is a kind of a special form of separation from the community. It's for people who have tested positive or maybe who have severe COVID symptoms and have not been able to return home to receive care at their home. There we only have 2 people per bathroom to try to limit any exchange of disease. So in the event you were placed in Dodge North, you'll get daily health and mental and physical health checks. Your food will be delivered. You'll get to order through the online ordering system. We'll bring you food. People probably will have extra suits on, PPE equipment to make sure they don't catch a disease if you have COVID. And so you'll be getting connected with your courses remotely. Academic support will be provided. We're going to be asking a group of students to be ambassadors to help you stay connected with our community. So we want everyone who's in isolation or quarantine not to feel kicked out or kept out, but kept part. And you'll have a special part in our campus community during this time. You all are coming to college at a unique time in history. And so you might consider it a badge that you went to quarantine during your time in college, because you did your part to keep our community safe. You complied with our rules, you went to quarantine when you needed to, and you made sure you were safe so others would be too. If you had to go to Seneca Falls, we'll make sure you get all the same support that everyone in Dodge North would get. So,
Dean Kenyon, speaking of support, there's a question about, if there was a, God forbid, a fatality or some very serious consequence of COVID on campus, would grief counseling be available? And I'm not just talking about people in quarantine, but just to anybody, any student on campus.
Well, grief counseling is always available. And unfortunately, there are many ways in which people may die in a college community. And so COVID is really the least likely, I would think, right now. It's a possibility, but we would certainly be supporting students and families if that ever were to occur.
And if I could I expound on that just a moment?
Please.
Yeah, the question came directly from Leah. So Leah, I would like to address you directly. Great to see you on this, by the way. And aside from always offering the grief counseling, we are currently exploring options to make mental health services more widely available for folks and more widely accessible for folks for the upcoming semester and years to come. So this is something that we've again been thinking incredibly deeply about. So your concern is heard, and we're working to we semi-addressed it, and we're working to better address it as we move forward.
Thank you, Andre. We are working with the Community Medical Center. They're going to be our partner for monitoring the health status of students in isolation and quarantine. They're going to have some dedicated staff for that purpose. And Jobe Zulu will be making sure that all the support services that are needed are provided for students. If there was any medical emergency, we'd be using Auburn Community Hospital as a partner that we've worked with to make sure they're ready for us. They've got a COVID ward ready and available. So we have made our preparations, and we're going to do our best to keep this COVID under control. And we'll know whether we're doing so by following certain metrics. With screening, we're getting data every day from the screening practice. We're going to be looking to keep the number of people who complete screening and report symptoms or exposure to below 2%. We want to keep that below 2% on a 7-day rolling average. So we're going to be keeping track of the results from the screening. So for example, on a given day, if we had 550 employees and students complete the screening, well, 2% of that would be 11 persons not cleared to enter campus. 2% is a small number, but that's a number we want to keep low, because once the number grows, the spread of the disease grows. So our goal is to keep it below 2% for the screening results. And that way we'll know that we're doing a good job of complying with our rules. We also have a testing metric, all the testing that's going to be done. We're hoping that we can keep 3% or fewer persons who get a test from testing positive. We really don't want that to happen. We're going to be doing all these things that we've been talking about today to keep the testing down, to keep the positive results down from testing. And that'll be our metric. If we had 200 people taking the test in a week, 3% of that would be about 6 people testing positive. That would be a lot for our small community, 6 people testing positive. We don't want that to happen. We're trying to keep it below 3%. And so that's where we need your help and your support for these measures that we've been discussing today. This is the trigger, these metrics will trigger different kinds of response. A small number of positive test cases, we try to zero in on where those cases occurring and what kind of quarantine and isolation is needed to address that small number. If it becomes a micro response, there might be 10 to 30 positive cases. That's getting pretty high. We're trying to contain it. We're going to be isolating and remediating this flare-up that might have occurred. That they also consider a micro response. If it gets higher, considered a scattered response that requires ramping down. We might have to close a wing of a residence hall, close a building, put people in an academic class into quarantine to make sure that they're not spreading it to others if that's the source of the outbreak. So we'll be looking for where are these cases coming from in order to then take steps that keep the college operating while we contain the virus and keep people involved in their coursework remotely or through other measures. In the case it gets widespread, and we are required to have plans for even the worst possible case. If it starts to get widespread of cases above 50, we start to lose confidence that we can contain it on our Dodge North capacity. We're going to have to be possibly stopping everything and put everybody in quarantine You can still be here on campus, but everyone's in quarantine for 14 days while we sort out how this is going to be contained. If that fails and we go into an uncontrollable outbreak, that's where the college would have to shut down, and we'd have to move everybody out like we did in the spring. And we're certainly not wanting to go to that route again. We recognize it's a possibility, but it's one we want to contain through your good efforts in support of our plan. And so it requires that we work together. It requires that we cooperate, communicate, and support each other. This is a small community, and we can do it. We can beat this COVID. We can contain it, and we can keep this college open for the whole year. And it will be a unique experience. You will tell your children and your grandchildren that you lived through the pandemic in your college years, and you made it work, and you were successful. That's our plan. Tell us your questions now and later. We want to be here for you.
Yes, so please continue to put your questions in the chat. There is one I wanted to address, which was a question about, if there are COVID cases confirmed or suspected on campus, will the community be notified? And that is, in fact, something we are planning on doing. I just don't have the exact details right now. We'll be talking again this week with Cayuga Medical, Cayuga Health Services, who's helping us with the testing and screening. Basically, in a community as small as ours, we have to strike a balance between keeping, private information private, but also making sure we're notifying the community in a organized way. My guess is we might be sending out, weekly updates with, obviously no names or contact info attached, similar to how Cayuga County does a daily report. So, frequency and details, we're getting there, but we do intend on having some sort of weekly report or dashboard.
Thank you, Chris. Yes, these metrics will be reported, so you'll know where we stand.
Mm-hmm. Can we go back to the dining hall and the quarantine? How does that work if somebody is in quarantine for 14 days? How do the students get access to meals without unnecessarily endangering others around them?
They'll be given a chance to order online directly to order the meal of their choice. It'll be brought to them through an employee of the college will deliver the meals to Dodge North, and they'll be able to retrieve it with the meals to go containers that they are providing every student. All students will get the to go containers that they can exchange day after day so that they're both sustainable in using these reusable containers, but also being able to keep their to-goes separated from others. So we'll make sure they get good meals, maybe even better.
Something to add on to that as well is for anybody that is in quarantine or isolation, every single room in Dodge North has been provided a micro fridge unit. So some of the meals, it might not be a delivery for every single meal, like 3 times a day. It might be a once a day delivery, but everyone will have a way to safely store and then reheat food as needed in your quarantine or isolation space.
I also wanted to add that the well will be open, but it will be limited hours, and of course, only with a small number of people at a time to maintain density control.
And we will be reaching out to recruit students to be our ambassadors for those who are in isolation and quarantine. So we look forward to anyone who's interested in helping.
On that same note, how, in terms of what resident assistants or RAs are going to be expected to do, on top of their usual duties, how do you envision their job changing or being adapted in light of all of this?
That's a very, very specific question for a small cohort of our students, and those things are going to be gone over and reiterated and worked out via training. So training will begin shortly, and those who are RAs and also our orientation leaders, they'll be armed with all of the knowledge that they need to know on how to go about interactions, when to enter situations and not enter situations, and what have you. So all of those things will be gone over in training, and we'll make sure that we keep you safe.
Yeah, all of us are going to have to find a way to hold each other accountable. How do I tell you to put on your mask so you don't punch me in the face? Well, there are ways I can do that are nicer than other ways. And that's what we want you to do. We want you to help each other do the right things. And so if it means saying to somebody, hey, look, you need to put on your mask,
Right.
we want you to do that.
Somebody in the chat noted that if you're 6 feet away, you can't get punched in the face. So just keep that in mind.
Oh, good to know. I'll make sure I keep that 6 feet. Thanks.
We had a question that I know Linda answered in the chat, but I just wonder for everyone's benefit, a question about student employment and, will it be working generally the same way? Linda, I know you said in the chat that some positions may not begin until September 7th, which is a little bit later, and that's because of the need for some to quarantine and, get through the arrival period. Can you just expand upon that a little bit, please?
Yeah, sure. So, everybody's goal is to keep the whole campus community safe. And there's going to be some inconveniences that everyone's going to experience as a result. But at the end of the day, that's a good thing if it gets us through the semester. So in terms of student employment, I'm, asking supervisors to hold off. There are some exceptions, including RAs, orientation leaders, but to hold off on getting students started until September 7th so that we have a chance to see if anybody's unpacked the virus when they return to campus. So that's the justification for that date. But the positions are going to be posted very soon, any moment. And as soon as they are, you can start applying. So for that aspect of it is business as usual.
And I can vouch for that because Human Resources office are next to mine and they are frantically posting a lot of things right now.
Yeah.
So.
I just jump in for a minute too about tutoring. Yeah, just to piggyback off of what Linda was saying, tutors will be able to operate, of course, but in-person tutoring is going to be on that delay that Linda was mentioning, just to be sure that test results have come through and things are going okay on campus. But I'll also caveat that for tutors with, I'm going to really be encouraging virtual tutoring sessions. So if students come through that process of applying, you may be able to start tutoring virtually a little bit sooner than that date possibly. But I just wanted to put that out there as well.
And I also want to mention, I'm hearing that, in terms of students who need to speak with the business office in particular, it sounds like they may be doing most of their appointments online or over the phone. So again, we'll get more information out about that. But, that's just an example of how, the same services for the most part would still be offered just in a different way. So whether it's tutoring or visiting the business office or trying to punch the dean, it's all going to work out. The questions in the chat have kind of slowed and it's after 7, so I want to be respectful of everyone's time. Does anybody have any last questions or do any of the panelists want to say anything?
I just want to say we're really looking forward to having you back on campus. And I know that you all are equally looking forward to it. We have a lot to work out and we will. Stay in touch. If you have questions, please ask them. Read the plan, please read the plan, okay? That's your first step. And then contact Dean Kenyon, Andre, any of us, if you have questions. And tomorrow night, we have another session with your families, and we look forward to talking with them tomorrow night. Thank you all for being here. I think your administrative team is getting a little bit silly. So obviously, we haven't eaten in a long time. So we're going to say goodnight to everybody, and we'll look forward to seeing you.
All right. Thanks, everybody.
Bye-bye.
Bye.